so there were three abstracts that were presented yesterday of all of phase 3 trials looking at radiotherapy. The first two looked at men who have an intact prostate, meaning that they had not had surgery for the treatment of their prostate cancer. And they were both asking questions about reducing the time necessary to deliver radiation therapy. This is a topic that's been investigated for at least the last 10 or 15 years. And these were two very large studies that we've all been anticipating for a number of years. They are what are called noninferiority trials, which is a complicated statistical phenomenon to prove that something is not worse than something else. Indeed, in this case, that both of these trials demonstrated that the shorter courses of radiotherapy, which are far more convenient for patients and more cost-effective, appeared to be non-inferiority to a standard treatment, more like 8 weeks. This study from North America, RTOG 0415, compared essentially an 8-week regimen of radiation to a 5.5-week regimen of radiation, and the outcomes were virtually identical for chances of the tumor recurring and for short and long-term side effects, with a very small increase in moderate gastrointestinal side effects. The study entailed a little over 1,000 patients. The study from Great Britain was called the CHIP trial. It was a larger study. Over 3,000 patients were treated all over Great Britain. And this compared 3 different treatment arms. One was a standard 8-week regimen, and then one was a treatment with 19 treatments, and the third arm was a treatment with 20 treatments. And it turned out that the treatment with 20 treatments was virtually identical to the treatment over 8 weeks. There was no increase in the chance of the cancer recurring, and there were very similar side effects, again with a very small increase in gastrointestinal side effects that is not likely of a significant effect for most patients.